but how much is it a part of the CDC's charter, and who funds it?
Well, CDC, our role is to keep Americans safe. There's no way we can do that without working globally, because so many of our threats come from overseas. We also have a mandate through PEPFAR, which is our largest global health program. We also are the US lead for the polio eradication program. We've been working on this since 1988. We're closer than ever to the eradication of polio, but we've got real challenges in Nigeria and Pakistan. In 1988, there were about 350,000 kids who got polio that year. Last year, there were 225. In 2011, we had about a dozen outbreaks around the world. In 2012, we had none. 2013, we have our first in the Horn of Africa. We're dealing with it, but we need to get over the finish line. Disease eradication, eradication means it's gone forever, is the ultimate in sustainability and in equity, because it's forever and for everybody. And the other areas we work in global health include things like measles, where by expanding immunization, measles is a deadly killer around the world. We've prevented 4 million deaths in Africa in the last decade, and training programs and detection programs.
But do you have to find extensions of money? And then I want to move into ID in America. But is this actually part of something Congress funds you to do, or do you have to find adjunct funding?
All of the above. So Congress has specific programs that they fund for polio, for measles, for HIV, for disease detection. They also fund our general work, and we can't do tuberculosis control in this country where 70% of our cases come from overseas unless we also work overseas. So virtually every part of CDC has some global attribute or some global activity. To give you an example, you wouldn't think birth defects, which is a center at CDC, has a global component. But in fact, we worked for a long time with the Chinese 30 years ago to do a randomized controlled trial of folate in pregnancy to prevent neural tube defects, and that was what proved that it worked. And that's why we put folate in our wheat, and that's why we give pregnant women folate, and that's why we've reduced our level of neural tube defects dramatically and saved lots of money and lots of suffering.
So